All right, be careful out there, everyone. Just last week, a meteorologist from our sister station in Detroit took her own life.
We were so sad to report this, that Jessica Starr had been off work about 2 months after suffering complications from LASIK eye surgery. She came back for a day in November, but said the pain was too much.
In her last tweet on November 14th, she talked about her frustration with her recovery. She said, quote, "I really wanted to come back, but I need more time to recover. Please keep me in your thoughts during this challenging time." We'll keep you updated.
Jessica leaves behind a husband and 2 young children. Her colleagues say they are stunned and heartbroken and that she was a shining light in their lives. While we will likely never know what ultimately drove Jessica to commit suicide, it does bring up the difficult conversation of suicide prevention.
If you or a loved one are dealing with any thoughts of suicide or self-harm, we have people standing by to take your call. We have volunteers here from Menninger Clinic, from Lakewood Church. You see there on the left side of your screen, Mary Jo Rapini. She's someone that you may feel comfortable with because she's on our morning news so much. But the number is right there on your screen, 713-626-2696. There's someone that you can talk to who can give you resources and who can help give you hope. Continuing the conversation now with us this morning is Dr. Gloria Oyeniyi with the Menninger Clinic. I can't thank you enough for being here. You have been in there taking some of those calls. Has this shown you that there is a very real need in our community for something like this?
Yes. The holidays especially can be a very difficult time for people who are dealing or struggling with mental illness or just feeling alone or depressed or having suicidal thoughts. And so it's very important that we show the community that there are resources for them and that there's someone to listen, to talk to them and help point them out in the way of getting help.
What signs and symptoms can family, friends, co-workers look for to identify when someone needs help?
Sometimes they can be withdrawn. They can isolate from themselves. You notice that they're not behaving like their usual personality. Sometimes you notice that they look like they're sleep deprived, maybe using more substances than usual, looking like they're intoxicated, like their mood is more irritable, more sad. Oftentimes there are little clues that you can see in their personality or behavior that makes you concerned about the changes.
And sometimes they don't know what to do. It's the holidays, they might not want to let down a family or friend and let them know they're sad. So making a phone call like this can get you started in the right direction. What are people telling you? Does it seem to be the holidays that might be bringing on some of these blues?
You know, a lot of people are going through transitions right now. Some people are unemployed, they're going through financial problems, or just they're alone. They don't have family or loved ones by them. And they just want someone to talk to listen to them, to validate their feelings, and just know that they're not alone in this world. And so oftentimes it's just hearing someone to say, you know, I'm here for you, I listen to you, and let me point you in the right direction of resources. There are some people who have not had access to care for a mental health problem that they have. And what I thought was really interesting about the calls today, sometimes they just wanted to know, where can I go? Where can I go find a doctor or talk to someone about getting on medications or getting some counseling? And that's very powerful because some people don't have access to those resources.
We know depression is a risk factor of suicide, and a lot of times we think about, I think, that suicide is something that is contemplated over many months or even years before it happens. But can a single event trigger that behavior within just weeks of it happening?
It's very hard. Each situation is very different. For some people, it can be a very impulsive action based on a particular situation. And for some people, it's been something that's been going on for a very long time, maybe due to the mental health problem that they have, whether it's depression or substance use disorder. And sometimes it's impulsive. But what's very important is to know that it's very and whichever way it happens, it's preventable.
Well, I have been to Menninger Clinic to follow some of you all and see the difference that you make in people's lives, and it's restoring their lives. So thank you for that. And thanks for being here this morning to make a difference and to take those phone calls. I know our viewers really appreciate it. And we want you to also know about the National Suicide Prevention Lifeline. So this is a number that you can call 24/7. That number, 800-273-TALK, which is 8255. And again, right here at Fox 26 this morning until 10 o'clock, you can call 713-626. It's right there on your screen, 2696. Please call if you feel like you are hopeless or you just need someone to help lift you up. We'll be right back.